you a high-masking autistic person? This is the question. And really, what is high-masking autism? I've realized that actually many people aren't quite clear at times about what this looks like. So in today's video, we're going to go over 13 signs that you may be a high-masking autistic human. And please know that these signs alone absolutely do not make an autism diagnosis. They are one part of actually what can make a diagnosis difficult to obtain and are very common in many people who mask. So what does that mean? Now, we're not talking about words like high functioning or low functioning. In fact, those terms are not preferred. And the reason why is that functioning and interpretation of how well you function from the outside may not reflect the difficulty for the inside of a person. And in fact, we'll talk about an assessment and some places you can go to maybe take a few tests and understand more about yourself if you think you may be on the spectrum. I'm a licensed clinical psychologist, and this topic is a huge passion for me. So let's just talk about, well, what is masking anyway? Masking initially kind of formed around identifying women and girls on the spectrum, but now we know it includes a broad range of everyone who could be on the spectrum. But the idea is that you are engaging in conscious and or unconscious strategies, behaviors, ways of engaging that help you appear potentially less autistic, theoretically, and help you blend more easily into social situations, in which if you did not mask, your differences might be more noticeable, might not fit into the typical social dynamics and expectations. So these are kind of really sophisticated strategies that most casual observers and even those who are not aware now, who are clinicians and doctors, around what masking can look like, could make them using only the DSM, for example, which was basically normed on one specific population for the most part, which is higher socioeconomic status type white males, leaving out people of color, the BIPOC community, trans, all kinds of human beings, women, everyone who doesn't fit into that dynamic. And so we know that there are also reasons to mask in other more or less socially accepted communities for reasons around safety, not just like your physical safety, but your social safety, and many, many reasons why this is an important topic. So the bottom line is that it also appears that those who mask are more likely going to have potentially a higher IQ in terms of intelligence, because there's an awareness to a certain extent of like, I know what I'm doing is not necessarily what I'm supposed to do. And for example, when we talk about girls, we're talking about a community that is more expected from birth to be more social, to be more responsive, more aware, more empathic of other people in general. We're talking about gender expectations there. So it is an attempt to do this through things like social behaviors, analyzing your behavior, scripting what you say, mimicking others, really hypervigilance and monitoring, like I'm saying. And that is the core of masking. So we know now who masks and we know why we mask. Let's talk about some core features. Now, 3 of the main core features were identified by someone named Laura Hull and her research team, who developed an assessment called the CAT-Q, C-A-T-Q, the Camouflaging Autistic Traits Questionnaire, which I will link down below for you to access, which was a really groundbreaking tool that isn't looking at how we present to the external world for masking, perhaps, but what it feels like on the inside. And that is really the focus of today's video as well. Coco's crying. Hold on one second. Come on in, Peachy. You can hear my probably southern accent coming out more and more as I age, and maybe it's because I'm masking less. Okay, and so the bottom line is that this test found that there were 3 main themes when it comes to this term of really camouflaging, and masking is one of the dynamics. And so the first one is what we call compensation or compensatory strategies. And these involve mimicking and copying holistic norms. So basically here we're looking at what people tend to do in the more dominant culture and how they engage when it comes to their behavior, the way they talk, whatever. So we are doing things to mimic that, thereby not engaging in what we might do if these social rules and dynamics didn't exist. So number one is compensation. Number two is repressing autistic traits. And this is the word where masking is often used. So here we are repressing, monitoring, adjusting, over-focusing on other people, being hypervigilant to what we should or should not be doing in terms of what we believe is more socially acceptable in situations. And lastly, what's called assimilation. And here we are performing and really pretending by acting like someone else, by performing, doing the things we've seen others do in order to really repress those sort of basic autistic dynamics that we've learned often very early are no longer or were not acceptable. And this is really important. For so many of us, especially when you look at the expectations of gender norms, of society, of culture, of different types of people, we have been masking for many of us so long before we were even ever aware of it. So it has been ingrained into us. It's an unconscious attempt to avoid rejection, to learn to modify who we are, to inhibit our natural tendencies, once again, a cat hair, and to change who we think we are supposed to be. It's performative in some regard, but for many people, we are not doing it performatively, like with a plan. We are just knowing that I'm supposed to do these things, and or we were shamed or punished for behaving in certain patterns of behavior or ways of being in the world, and we learn not to do that. And as a result, we'll come back to this as one of the bottom line criteria of the signs, is that chronic exhaustion, fatigue, social dynamics can be very common. So at the heart, we're talking about, in many cases, doing the thing we're supposed to do and not knowing we're doing it. And in many cases, doing it so well that we just think it's who we are and others just think it's who we are as well. And this piece is why it is so important, I believe, to dive more and more into the research about how autism presents in people who identify as women, in girls, in people who are of any kind of different background where they would be motivated to mask for so many reasons. It does look different. I understand the desire to say there's no this kind of autism or that, but the truth is, until we understand the different presentations, I don't know how we're going to identify people and help them feel seen. And so that is why I am kind of sharing it in this regard. But this is important to know. It's not just these populations of women or BIPOC people in the communities that are masking. Cis males can mask as well. So it's for everyone, but how and when and why and where might vary. There are four really basic areas in which we are going to be more inclined. I'm going to use the word mask than camouflage, but really camouflage is probably the most appropriate term. But I think if I do that, I'll be more likely to say it the other way. Really around our sensory dynamics, our social dynamics, our communication dynamics, and our cognitive dynamics, meaning that how our sensory issues engage or not, how we interact with others or not, what the social expectations and dynamics are, and how we're thinking about what's happening when it's happening before, during, or after, frankly, a social interaction. So the number one sign is this, that you do these combination of things. If you might be high masking. Remember now, these are conscious and unconscious ways of kind of shaping, molding, and sculpting who you might have been or really are, intentionally or unintentionally, right? To be accepted, to engage with others and things like that. So when you're alone, you probably aren't masking in the same way. When you're with people you're really comfortable with, you're not doing that. And I've shared that when I began making videos, and my sweet kids would say like, oh mom, we're so proud of you, but like that is really not who you are. And I have no doubt, as someone pointed out a few weeks ago, I'm still masking, but I'm also masking as a clinician and psychologist. And how I reconcile those, I don't know. I will say I think I am more often than not at least the most publicly social person of who I am. probably minus my tendency to use my Texas language that I grew up using in terms of bad words and good words. But other than that, that's a difficult piece for me, but I am trying, okay? So number one, you endure, conceal, minimize, force yourself in some way to deal with sensory issues, overstimulation, and all of those things. So you might be able to, or you've learned to tolerate the discomfort in the clothes you wear to work, and how you have to tolerate noises and sounds and lights. And all of that, you've been doing it so long, but you don't realize at times that it's deeply dysregulating and uncomfortable, but you have this like window of tolerance where you can tolerate it. But if all things were equal, like for example, if you could wear sweatpants to work, you would, right? As opposed to if there was a work dress code. Which, by the way, really quickly, in the 90s, at a PR firm, my first job out of college as women, open and run by a woman's PR firm in San Diego, we were not allowed to wear pants except on Fridays, and it had to be a pantsuit. So, and I hated, this is actually, I didn't think about this. I hate pantyhose. Like, so triggering. And that back then, it wasn't a thing where you didn't wear them. You had to wear them with skirts and dresses. So that being just like so triggering and deeply uncomfortable, but having to find a way to deal with it. Actively hiding or faking your aversion to foods, to textures, to tastes, moving food around your plate, saying you're not hungry. Like I've said, I could not handle eating other people's food. And so always at a classroom party or work event or buffet situation, I never eat at those things unless it's my best friend that's cooked something or a cookie, like something easy. I will always say I've already eaten. And in fact, I would. I'm not saying that makes me autistic, but that's an example. But the bottom line is you are trying to manage that you are overloaded and overstimulated in any one or all of your sensory areas, but you've learned to find a tolerance window. Now, we'll talk about what it does to you in another sign. Number two, suppressing the urge to engage in repetitive behaviors, seeking sensory input. Remember, we can have sensory avoidance and we can have sensory seeking behaviors in autism, and also in ADHD potentially. And so we're like avoiding touching specific textures that we want to touch or things we want to play with. We're really like pushing down the urge to engage in behaviors that we know we are not supposed to be doing. So it could be tapping, skin picking, all kinds of stimming behaviors, things like that, touching, seeking sensory input, avoiding it, things like that. Number three, we repress, hide the urge, desire, or need to stim or distract ourselves by doing something more acceptable. So this is like a deeper part of number two. And so we are really talking about stimming specifically, not just sensory seeking or avoidance, but stimming. And here we are trying to find a way to make whatever we need to do that would feel better for us more acceptable. So you repeat phrases in your head. You might listen to music on repeat at work. You might tap your foot. You might, notice that chewing on a pen or a pencil or any kind of hair twirling, whatever it is, you would rather be doing something else, but you kind of substitute it or just try to stop it altogether. Number four, you imitate, mimic, copy in some way to when you're going to be in social situations, you mimic, copy, or prepare to do those things by memorizing phrases, from TV shows, from books you've read. You over-focus on what helps you fit in, clothes, makeup, interests, things that you think others will be, in common. And you may actually have a special interest in those things. That is in part why in some of the girls, if they had, their special interest was makeup or clothes, they would think, oh, well, you're too focused on that, so you can't be autistic. So the point is that you are literally copying, memorizing, mimicking what you think is supposed to be. And I've talked about this, where I'd always have makeup trends or certain shoes and handbag to help me fit in, to seek out trends. And a lot of the times I really was not comfortable in those things, but it was a way to sort of fit in. So that's an example. Number five, you practice and script conversations and monitor conversations while you're having them about what to say, when to say it, oversharing, undersharing, concealing special interests that you know would be considered weird or odd, being overly accommodating, overly nice, agreeable, avoiding conflict. This is that often fawning or people-pleasing behavior, that people-pleasing dynamic that might be pushing down what's really going on for you, but you're using it in a way to not let your real, true, authentic self be seen so that you are more accepted. Number 6, over-focusing on eye contact. How many seconds to hold it, when to look away, how long you do it. Engaging in ways of monitoring your verbal and non-verbal behavior. What are my eyes doing? What is my face doing right now? Oh, I'm making a weird face, or I can't forget not to do that weird thing with my tone of voice. Using speech patterns, high pitches, low pitches, accents, doing things like that, speech patterns, trying to match the other person's facial expressions, and like you're a forced kind of mirroring dynamic where you're trying to give back what feels like acceptable social behavior. But you are really over-focused, or you haven't focused on it, and there's some kind of, outcome of that has been, frankly, even traumatic, given now that we know that those with autism can be more likely to have trauma from even mild stressors. And I would argue that, definitely uncomfortable, harmful social situations could definitely create trauma, especially if they happen repetitively. Diligently adjusting your body language to appear interested and engaged in conversations, continuously monitoring and adapting those things while you're doing it. So you're really trying to fit these social norms, verbally, non-verbally, and otherwise. Number 7, when you're struggling with something like exhaustion, anxiety, fatigue in the situation, you try to hide it. So you try to, not present what you're feeling. So I often feel this. I just got my hair done and I can sit there and chit chat, but deep inside it is so uncomfortable, and it has nothing to do with the people I'm talking to for the most part. Or if I don't know them well, I'm giving them my surface level version. And everyone has some of this, but it's like I will dread it. I just got my roots done, maybe if you can tell, and I like that. It makes me feel better. It's one of the few things I actually do that are kind of self indulgent in some way. And in terms of aging, I have no other things I do because I'm scared to do those things. No judgment if you do, but for me, my hair is important, so I'm not going to give that up and then have gray and brown. My son was like, "Why don't you go brunette again?" I'm like, "Now I have gray hair, and then that'll be popping up right away," which, by the way, blonde hides. Okay, the point is, it's so exhausting. I went in and got my hair done, which is, everyone I think finds this experience exhausting. I'm not saying if you're autistic, but I came home and I could not function the rest of the day. Also, I'm not sleeping well because of my hormone situation and having hot flashes all night. So let me just load that by saying, or preload, I was already really tired when I got there. But the point is, all of that makes us also then want to avoid or minimize or limit or panic and leave social situations. But you are not telling people, "I'm freaking out right now. I'm having so much social anxiety. She's talking too loud and he's smacking the chips at the table and the lighting over here is killing me." You don't do any of that. You've learned to contain it all, but then you get in your car and go home and you are wiped out, maybe for days at a time, depending upon the event. So it impacts the way you engage, not just in the moment, but also your recovery time, which is a huge part of what this camouflage and masking does. One of the biggest side effects is what it does to our bodies and minds in the effort and service of camouflaging. Number 8, you hide or change the way you would normally respond to a problem. You hide or pretend like you don't have the kind of executive functioning issues, planning, organizing, paying bills, getting your food on time for your home, like your groceries. It is this smoke and mirrors often about what really goes on. Or you might be in a group situation and approach a problem in what you think is a more neurotypical way. Because if you shared the way you do it, you feel like that wouldn't go well, or you've already been socially rejected for that. So you're really struggling often in traditional learning situations. You're trying to hide your unhappiness and discomfort with things like plans changing. For many autistic people, a late cancellation, if that was what their mind was set to, is a big, big deal. A lot of the routine and repetition is important. And so when anything gets changed, that can be a problem. Now, as I keep saying, if you're also ADHD and autistic, which is quite often likely, the ADHD part of your brain can love the novelty and distraction, and the autistic part can be really dysregulated by the sort of like, what are we doing now? We're changing everything. But the bottom line is you might melt down later, so you're containing all of that. I've watched many people, when plans change, which you would think like big deal, like, okay, it's fine, on the phone or on the text, be like, okay, whatever, and then later just fully melt down about it. Number 9, chronic raging hypervigilance. Relational, interpersonal, emotional. This is the part where you are, while you're doing all these things, hyper aware of how other people are perceiving you in the moment, striving to meet their expectations, having a real heightened awareness of the impact, the impression you're making upon them, which can really contribute to more hypervigilance and more self-consciousness. Persistently being vigilant in monitoring and adjusting everything that's happening socially so that you can like present like you're fine. Once again, internally, you are not fine. Number 10, when you're having conversations, many times, especially with people you're not close to, the situations and conversations feel awkward or unnatural, or they don't feel like they're kind of flowing in a smooth kind of way. You might find that you are presenting to or pretending to be normal, or like I've said, whatever your job is, you're being, this reminds me of the Barbie movie, you're being, beach, you're being therapist, you're being waiter, you're being boss, whatever it is. And it feels like that. And so that social situations feel like performances rather than real chances for connection, things like that. And while you're interacting with others, it's like while you're doing it, it's exhausting and it feels forced. It feels like you have to be consciously aware and make effort for what you're doing. Number 11, many people with autism feel best when someone is with them. So you tend to rely on other people being with you to do things like doctor's appointments or make a phone call, which can be obviously super triggering. I'm laughing because I did this all of my 20s and 30s and had no idea this was a sign later on. So there's a belief that you can't really be yourself, or that you can only be yourself around close others. There's this dynamic where you alone in things is quite challenging. Number 12 is that you've always felt different. This is where I've said, like all of my life, I felt like I am an alien. What is wrong with me? And I thought that it was only complex trauma. But when I've done this research, it just doesn't cover everything or frankly get close. There were many things that were very much a part of my childhood. And as I've shared in many videos, I really believe I've had a lot more relational and PTSD trauma in my adult life after the age of 23. So that doesn't explain raging sensory issues in childhood, friendship issues, stimming, routines, difficulty with being uncomfortable, as I've said, bothered by everything and everyone. So there's like this mismatch between what you present like, no matter what that is, and who you feel like you are inside if you're engaging in some kind of camouflaging or masking. And lastly, as a result of all of this, you have this raging anxiety. I think I have yet to meet and it's not that many people, but anyone who's autistic who doesn't have a pretty decent amount of anxiety. So there's like this worry, stress around interactions, phone calls, engaging. When it comes to social dynamics, there's an inherent anxiety that seems to be there in varying degrees at all times. So what can you do about it? Number 1, I'll link down below once again where to take the CAT-Q and other tests for autism, which the website's called Embrace Autism. I'm not suggesting that those tests alone should give you a diagnosis, but I think that if all the tests or most of them are coming back in a certain way, don't forget many of them were not normed on these populations I'm talking about today though. So even within the testing, there's a lot of bias and a lot of minimizing and lack of understanding of what this could even look like, especially for women, the BIPOC community and things like that. Let's start there. That can be really helpful because the CAT-Q is really about camouflaging. Reflect on which of these I've talked about or all of them, how they show up for you, what that feels like. Don't rush into it. Take your time, like really imagine, because when you first read the criteria, if you don't get these deep dives, I think it's easy to go, yeah, no, that's not me, but what is me? Look at diagnoses you may have received. I've been talking about recent research that talks about many of the newer articles are suggesting that if you have received a diagnosis of borderline, especially if you are a woman, that you should potentially be screened for autism as well. watch, listen to, and like literally spend time with other autistic creators online or people that you know, because that is where you will really see it. There will be so many people who say, they'll be talking about their autism experience, and they will tell you they have a formal diagnosis, even if you need that to believe them, which is still not necessarily the case. Self-diagnosis can be very valid, and diagnosis in and of itself is a whole other conversation in terms of what it may or may not do for you, especially if you are high masking and depending upon where you live. So research that. Look at books like Unmasking Autism, websites like the Embrace Autism website, different places to look at. You can Google research articles and read the summaries pretty quickly. Just go to the conclusion part or the discussion part if you want, if you're not really into research. There's great summaries there about what they find. Think about your struggles. Look at, where do you really struggle? For me, my sensory issues have been huge. It was a big piece of this for me. Friendship, looking at friendships, I only looked at it through the lens of, well, I had a really unhealthy mother and all of that. And I'm not saying that hasn't been a part of it, but there is so much more now that I understand about who I was drawn to, why I didn't speak up for myself, how things played out, the history of that and those things. And trauma does make an impact. So it is not just only autism or only trauma that can impact friendships, for example. Look at your stimming, your routines, the deep mismatch you may have. And all of those things might help you understand. It may be that you just have anxiety, which is not just. Anxiety is huge. It may be that you have ADHD. It may be you have borderline. It may not be autism. It may just be trauma, because there is a lot of overlap. That's what makes this so challenging. But it is important to look at, okay, whatever it is, what do I want and need to do about it, for example, to kind of help myself live with this thing? Is it workable in therapy? Is it more of an accommodation? Like, this is just how my brain works. So things like taking more breaks in between tasks, transition time, how you transition. For many people who are neurodivergent, transitioning from one thing to the next is often deeply dysregulating. Looking at your sleep cycles, how you set boundaries for yourself, using things like, earphones. There's all kinds of little things that can, over time, act as a support system for you. So that's it. Once again, this is longer than I wanted it to be, but I hope it was helpful. I think that this concept, I realized that someone had asked me not too long ago in some comment sections, like, well, what is high masking? And so obviously you would want and need to meet the bulk of the criteria for autism. Things around sensory issues, communication patterns, routine, repetition, looking at those neurodevelopmental pieces. So this is one part of it. But this part of it, this high masking piece, is what has been the most neglected, I believe, in the research. So that's it. Thank you so much for being here. Please stay safe and well. Please check out my courses online that I put so much love into, because I also believe if you believe you are high masking, there's a very good chance that your parents were also highly unpredictable, inconsistent, that they struggled with some combinations of diagnoses, trauma, autism, ADHD, bipolar, borderline, things like that, even narcissism, which can also overlap or look like autism, and vice versa. That just because you're autistic doesn't take away the trauma you've often endured in your childhood, or the trauma that you continue to endure in your adult relationships that you might be even reenacting and not know about it. So that's it. Have a good day. Stay safe and well, and I'll see you soon. Bye.